Today, we're going to compare Sertoli cell tumors, Leydig cell tumors, and Granulosa cell tumors across the major species. The easiest way to organize them is to remember that Sertoli and Leydig cell tumors are testicular sex cord stromal tumors, while Granulosa cell tumors are ovarian sex cord stromal tumors. So the real question is not just what organ is affected, but what hormone is the tumor making, and what clinical syndrome does that hormone create. In dogs, Sertoli cell tumors are the big one to recognize because they can produce estrogen, especially when they occur in a retained testicle. That estrogen can cause feminization. A male dog may develop symmetric alopecia, gynecomastia, attraction of other males, a pendulous prepuce, squamous metaplasia of the prostate, or even bone marrow suppression with anemia, neutropenia, and thrombocytopenia. Cryptorchid dogs are especially important because retained testes are at higher risk for testicular tumors, and Sertoli cell tumors in that setting are more likely to be clinically dramatic. Diagnosis starts with finding an enlarged or asymmetric testicle, checking for cryptorchidism, evaluating CBC changes if estrogen toxicity is suspected, and confirming with histopathology after castration. Treatment is surgical castration, removing both testes, and if bone marrow suppression is present, the prognosis depends on whether the marrow can recover after the estrogen source is removed. Sertoli cell tumors are remembered as the estrogen problem testicular tumor. Leydig cell tumors are different. Leydig cells normally make testosterone, but in dogs these tumors are often small, incidental, and benign and often usually found during a physical exam, neuter, or necropsy. They may still cause testicular enlargement, or asymmetry, but they usually do not create the obvious feminization syndrome that makes Sertoli cell tumors memorable. In an intact older male dog with a firm testicular nodule and no systemic signs, Leydig cell tumor is a major differential, but you still treat it practically the same way, castration and histopathology. Malignant Leydig cell tumors can occur, but they are rare, so for exam purposes Leydig cell tumor is the usually incidental interstitial cell tumor, while Sertoli cell tumor is the one that can make the whole patient sick hormonally. Granulosa cell tumors are the ovarian comparison, and they matter most in mares, although they can occur in cows, dogs, and other domestic species. In mares, Granulosa-theca cell tumors are classic because they can secrete inhibin, anti-Müllerian hormone, estrogen, progesterone, or testosterone, so the behavior can vary. Some mares show prolonged estrus, some show anestrus, and some become stallion-like or aggressive from androgen production. A very testable clue is one enlarged ovary with a honeycomb or multicystic appearance, while the opposite ovary is often small and inactive because inhibin suppresses FSH. Diagnosis in mares combines rectal palpation, ultrasound, and hormone testing, especially AMH, inhibin, and testosterone depending on the case. Treatment is ovarectomy of the affected ovary, and the remaining ovary often returns to function after removal. In cows, granulosa cell tumors are less common than routine cystic ovarian disease, but they should be on your mind when one ovary is persistently enlarged, irregular, or multicystic and the cow has abnormal estrus behavior or infertility that does not fit a simple follicular or luteal cyst. In dogs and cats, ovarian granulosa cell tumors may present less dramatically, but you can see persistent estrus, abnormal vulvar discharge, pyometra-like changes, infertility, or abdominal mass effect. In small animals, diagnostics usually include imaging and surgical exploration, and treatment is ovariohysterectomy with histopathology. So the big takeaway is, Sertoli cell tumor relates to estrogen and feminization, Leydig cell tumor is usually an incidental testicular nodule, and granulosa cell tumor is usually a hormonally active ovarian tumor, especially the abnormal behavior, enlarged ovary tumor of mares. The exam trick is to connect the tumor cell of origin to the hormone, then connect the hormone to the clinical signs.